So hello everyone, my name is Al-sodaire mga tong. So today I will demonstrate to you the Glasgow Coma scale. Definition: the Glasgow Coma scale is the summation of scores for eye, verbal, and motor responses. The, the score is determined by the sum of the score in each of the three categories with a minimum score of 15, which indicates a fully awake patient, and a minimum score of 3, which indicates deep coma or brain dead state. So the purpose is the Glasgow Coma scale is used to describe the general consciousness in patients with traumatic brain injury and to define broad categories of the head injury. So the first procedure is perform hand hygiene to prevent spread of microorganisms. Assess eye opening, a maximum possible score of 4 points to evaluate patient's wakefulness and awareness of the environment. Initially, observe if the patient is opening their eyes spontaneously. If the patient is opening their eyes spontaneously, your assessment of this behavior is complete. Automatically score for 4 points. You would then move on to assessing verbal response. If the patient is not opening their eyes spontaneously, you need to work through the following steps until a response is obtained. You need to speak to the patient. Kay misilungan. If the patient eyes open in response to the sound of your voice, score 3 points. You would then move on to assessing verbal response. If the patient doesn't open their eyes in response to sound, you need to move on to assessing eye opening to pain. Example, applying pressure on the nail beds of the finger for 10 seconds. Next, if the patient's eyes open in response to a pressure on the nail beds of the finger, score 2 points. You would then move on to assessing verbal response. Next is if the patient does not open their eyes to a painful stimulus, score 1 point. You would then move on to assessing verbal response. Next, if the patient cannot open their eyes for some reason, you should document that eye response could not be assessed. You would then move on to assessing verbal response. So the next is assess verbal response, a maximum possible score of 5 points to evaluate patient's wakefulness and awareness. So initially, try to engage the patient in conversation and assess if they are oriented. Some common questions you can ask to help assess this might include: can you tell me your name? Do you know where you are at the moment? And do you know what is the date today? So, hi ma'am. Ano po bang pangalan niyo? So, sa tingin niyo po ba, nasaan po ba tayo ngayon? So, ano po bang date ngayon? If the patient is able to answer your questions appropriately, the assessment of verbal response is complete. score 5 points, then move on to assessing motor response. If the patient is able to reply but the response doesn't seem quite right, they don't know where they are or what the date is, this would be classed as confused conversation. Score 4 points, then move on to assessing motor response. So, ma'am, alam niyo po ba kung nasaan tayo ngayon, ma'am?
Sa kwarto po.
Alam niyo po bang anong date ngayon? Ano po bang name niyo? If the patient responds with seemingly random words that are completely unrelated to the question you asked, this would be classified as inappropriate words. Score 3 points, then move on to assessing motor response. Next is, if the patient making sounds rather than speaking words, then would be classed as incomprehensible sounds. Score 2 points, then move on to assessing motor response. Hi ma'am, good morning. Ano po bang name nyo? Alam niyo po ba kung saan tayo ngayon? Alam niyo po ba kung anong date ngayon o araw? If the patient has no response to your question, score 1 point. You would then move on to assessing motor response. Next, if the patient is intubated or with tracheostomy or has other factors interfering with their ability to communicate verbally, the response cannot be tested. And for this, you would write NT or not testable. You would then move on to assessing motor responses. Next is assess motor response or a maximum possible score of 6 points. To evaluate patient's ability to obey a command, localize, withdraw, or assume abnormal body positions in response to a painful stimulus. So, ask the patient to perform a two-part request. Lift your right arm off the bed and make a fist. The patient able to follow this command correctly. Score 6 points and the assessment would be over. So, ma'am, pwede niyo po ba itaas yung kamay niyo? So, if the patient does not obey the command, apply painful stimuli. If the patient make attempts to reach towards the site at which you are applying a painful stimulus and bring their hand above their clavicle, this would be classed localizing to pain. Score 5 points and the assessment could be over. If you applied a painful stimuli and the patient tries to withdraw from the pain, the patient tries to pull their arm away from you when applying a painful stimulus to their fingertip, score 4 points and the assessment would be over. Next, if you applied a painful stimuli and the patient responds with an abnormal flexion, score 3 points and the assessment would be over. So next, if you applied a painful stimuli and the patient responds with abnormal extension, score 2 points and assessment would be over. Next, if you applied a painful stimulus and the patient as no response, score 1 point and the assessment would be over. Next, if the patient is unable to provide a motor response, this should be documented as not testable. Once you have assessed eye-opening verbal response and motor response, you add the scores together to calculate the patient's GCS or Glasgow Coma skills. So, documentation contributes to continued data collection necessary for the client's care plan. And the Glasgow Coma scale should be documented showing the score for each individual behavior tested. That's all. Thank you.